And then we're feeling for the portacath here. And they were talking that the portacath in most that we've seen is much higher than that. And what they've seen in real patients, it's more up here. So a shorter diameter here. So that you guys can come up and kind of feel the difference here. This is the one that requires the Huber needle, the central line, and then the PIC line that's in there for long term. And this is just actually an IV access. So, any questions, thoughts? Want to play with it?
Mm-hmm.
So, this is where that is. We're going to get some optional parts for the critical care class. There's a lot more that this mannequin can do. So we're going to get those parts and get them ready to go.
Most of the access that I've seen too is in the right chest.
It's
almost always in the right chest.
Always.
It's rarely on the left side.
Always.
Me
That's
too,
probably
because
right
the
up
clinician is right-handed or something. You know, it's got to be a stupid
So
reason.
come
No,
you guys,
I think it's because it goes into the right. They want it to go into the right subclavian
Yep.
instead of into the left side.
A lot of times they sit right in the right subclavian or like at the very tip of the right atrium.
yeah. And this, we just have it on the left, so you
No,
can,
I understand. I'm just saying. For
over here.
yep. It's
And I've seen
almost always, no matter
some
what kind
in
of
both.
whether it's a portacath or a Gershon or a Broviac or a Hickman.
Always
always
in the
Almost
right.
always right up here.
Right. And I don't have those other two, but we will when the stuff comes in. So if they come in before the end of the refresher, then we'll get to play and move around with these. But they're all on back order right now. Okay. Any questions, thoughts, anything else you guys want to tell me about it? I can kind of feel it here. Kate, you do access a lot of these. Or while you're starting to, you will eventually.
I won't say I've accessed a lot of access, a few.
Can you take somebody through it, how you do it on the mannequin?
I guess just, you know, the biggest thing is make sure that the area is sterile. A lot of times, you know, unless it's an emergency situation, we'll have the patient and ourselves wear a mask. So, and just put a drape around it that's sterile. And then the biggest thing is just hold this with 2 fingers and get it flat. A lot of times it won't be sitting in there totally flat. So the biggest thing is just 2 fingers. Just try to get it so it's kind of standing up a little bit and flat. And then it's really, I mean, you just take that Huber and you just kind of push it in there, and it's a little bit of a different feel than going in a vein. Kind of the same thing. Once you put one in, you'll kind of get that feel, a little bit of a pop. Sometimes you'll hear the needle kind of hit because there's a metal base at the back of that port, and you'll kind of hear a little bit of a click. And then it's kind of the same thing as an IV, you know, you see if you have any blood return, if it flushes easily, no pain, you know, nothing that swells up around here. Kind of the same thing. Biggest thing is just getting it flat. If it's turned at all, it's not going to go in there and be fat. That and keeping it sterile.
What about the PIC line? The arm one there. And anything, nothing different there really when you're accessing that?
Not really that I can think of that you do.
Hardest part, remember to put the clamps before you disconnect. 'Cause then the
Yeah,
whole blood tube-
definitely that. No,
Yeah.
you don't want any air. Same thing with that, keeping it sterile.
Keeping
no
the
air.
clamps.
And
Isn't a
you
peripheral
flush them
IV?
different.
Peripheral IV, you can just take it off, disconnect,
Right.
and then
Yeah.
put. And the minute you do that one, it's going to backfill full blood.
So you have to have the clamps.
And you flush in like the wave-like motion. You don't just like you flush an IV, you just flush it through. This, they want you to, especially when you're heparinizing, like a wave-like motion, because that'll kind of move, I guess, everything through better and prevent clotting. So like you flush with that motion, and then the last flush, you clamp it.